EGM Network.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon, and welcome to Community Conversations. If you're just joining us for the first time, let me introduce myself as more than the CEO, but a member of a phenomenal team of 8 different locations around the community that offers primary care, whether it's medical, dental, behavioral health. We try to pack as much into each location as we can for your convenience and for the ease of reducing duplication. As part of the community, though, we understand that it takes a lot of successful elements supporting each other to make this the wonderful place that it is. And so this community conversation invites people from various aspects of our community to come and talk about their role in the community, what they do, what they'd like to do, collaborators, volunteers, other folks. And so today is no exception, although it is a first time for us, I think, having the Children's Home Society folks here. And they have 2 brand new shining faces that have joined their organization. And so I'd like to welcome both Lauren and
Dennis.
See how bad I am with names. I can do a lot of things, but names just gone. Lauren, why don't you tell us what you do?
Sure. So good morning again, and thank you for having us, Vicki. We appreciate you bringing Children's Home Society here. So my name is Lauren Fuentes. I am our Vice President of Child and Family Wellbeing. So what that means is I have a statewide position where I oversee all of our programs, all of our child welfare, all of our shelters, our group homes, our diversionary programs, also our CPT programs. So
that's an acronym we're not familiar
Child
with.
Protection Team.
Thank you.
And I apologize. We're a very acronym-based organization.
Healthcare is as well.
But while I do have that statewide role, and I've been with CHS for about 5 years now, I live in the Treasure Coast. So I am a local here. I have 2 kids who go to Indian River School District schools. So I'm excited to be here and partner.
Can't believe we haven't met before.
Yes. Previously, I was the executive director in Palm Beach and then took the statewide role when it came in. And I've actually, and Dennis will introduce him, we've known each other for over 20 years.
Yes.
And working together. So we're glad to be back together, working together again. So thank you.
But before we started, Dennis mentioned that he's really fresh in this role. About 3 weeks, I think you said?
About 3 weeks.
Okay.
Brand new.
Congratulations.
So I'm Dennis Miles. I'm the new Regional Executive Director for Children's Home Society, and I couldn't be more excited to be here. This is an awesome opportunity for me. By way of background, I spent 20 years in the Department of Children and Families. In the last 12 and a half years, I was the Regional Managing Director for DCF in this area. So I've got a lot of experience throughout the Southeast region, which was Broward, Palm Beach, and the Treasure Coast.
It's a big region.
It's a huge region, and the fact that the region that I have now with CHS mirrors the region that I had with DCF. So I know many of the legislators, the judges, the CEOs, the partners and programs out there. This is almost like a reunion to me to come back. I briefly retired from DCF back in March, and I found out that there was an opportunity here with CHS, the opening for the regional director, executive director, I guess you call it, and I jumped at it. And I got to tell you, couldn't be more excited to be back in the game. And through all my years with DCF, I worked very closely with CHS. I partnered with them on many projects and over time, and I had the opportunity to serve in 4 of the 6 regions of DCF. I also led the Northeast region, the Suncoast region, and the Southern region, which is Miami. And everywhere I was, CHS was. So I had that opportunity to work with them and establish relationships, and now I work with them, and I couldn't be more excited.
Retirement's not always what it's cracked up to be as a dentist.
Well, I'm 0 for 2 in retirement. I also retired in 2017 for a brief period and got called back to DCF and accepted that opportunity. And originally that time it was supposed to be for 90 days, and I ended up staying 6 more years.
I can relate to that.
So I like to stay active, and I love child welfare. I love what we do and the mission that we have and the vision. I jump immediately at it.
Well, and I have to say that when I was a younger woman and I heard it's not what you know, it's who you know, and I was struggling to get successive degrees, I thought, well, that's pretty ucky. You know, who would say that? But I found that in collaborating with other people, it definitely is who you can pick up the phone to and say, can we problem solve for a minute? I need your help. Or I've heard that you're looking for X, Y, and Z. And so I think particularly in a smaller town like Vero Beach and Sebastian, Fellsmere, those are the kinds of things that help us be better at what we do. And so we're not so much in silos.
Relationships are everything. And when you've built those relationships and you can pick up the phone and say, hey, look, we've got an issue. Let's get together and let's see how we can resolve this. And that's what I think I can bring to the table is I know a lot of the people already because I've been dealing with them.
So, Lauren, for the folks that aren't very familiar with CHS, can you give us kind of a 60,000 viewpoint in terms of, you mentioned a lot of different things, but maybe talk back to the roots and how you've grown and how it has affected our community more recently.
Sure. So CHS is a statewide organization. So we do have a presence across the entire state of Florida. And for those who don't know us, we've been around over 120 years. So that is a very, very long time. We are the largest, oldest statewide nonprofit.
Is that coming from the roots of the orphan train, perhaps?
Yeah, so you know our history. So so that is where we started. Obviously, the services we provide today are much different than the orphan trains coming down the East Coast and helping. But our roots are in adoption, and we do continue to do that services. Here in Treasure Coast, we continue to provide adoption services as well.
And that's a word you don't hear very often anymore, sadly.
Yes, and we do adoption several places, but these children that are out there that can't go safely back to their parents, because we always want kids to go back to their parents. That is our number one goal across the state and working with the Department of Children and Families. But when they can't, we want to find that parent who's the perfect fit for the kid, not the kid for the perfect parent. But we need to find those parents that can really understand the trauma that these children have gone through, the trauma of the removal, the trauma of what happened in their family, and understand that parenting them is going to be different than maybe parenting your own biological children.
Having adopted 4, I absolutely see what you're saying.
Awesome.
Well,
fantastic.
It was one of those things. I don't know how to explain it. It was not part of my life plan, but it is what it is. So here in the Treasure Coast, I think we've probably heard the most notoriety out of the community partnership schools, okay, because that is, again, a collaborative thing, and it's an opportunity for each school to learn from the schools that have gone before them in terms of, as you say, the difference between parenting your natural child as opposed to an adopted child, the difference between being part of a school district and having the special resources that come with a community partnership school. So it's my understanding that CHS has about 20 partnership schools already.
31?
Yeah,
I'm way off base.
Yeah, we've just added, I think, recently added 6 more, so it's up to 31 right now.
Okay. And those partnership schools can be at the elementary, middle, or high school levels, correct?
Yes.
I think it's easier at the high school myself, but be that as it may, we're deeply involved. Treasure Coast Community Health is one of the 4 partners that are required to have a community partnership school because we signed a 25-year agreement. So it's not a flash in the pan. It's not something you do on a whim. It's not something that, if it doesn't work out, it's the flavor du jour. You figure it out. You keep working at it. And so those community partners, the health perspective, a local college, as well as a school district. Those are the key partners, but then certainly we want to engage all of the community in that respect. And so can you talk a little bit about how you support that?
Sure. So
Okay.
you mentioned a lot about the background of Community Partnership School. One of the things that I love about that model is that it's that 25-year agreement.
You should have seen my board gulp when I suggested it. They were like, we're not going to be here. Well, somebody will be here because Treasure Coast is over 30 years old. So
And when we
we're not going
approach a
away.
new school district, that's the same reaction. 25 years, yes, because if you really want to see true change in a community and a school, you need that long-term dedication to get to your end result.
Yeah.
Programs where you get a grant and you provide services for 2 years is fantastic. But then when that funding goes away, what about the kids coming in for the next grade? So that is just massive. And it has those 4 core partners. So, Treasure Coast Community Health is our healthcare partner. We've got Indian River State College, obviously the school district of Indian River, and then Children's Home Society of Florida as the nonprofit. But really convening, and really our role at CHS is convening all those partners. So how can we work together by providing all of those wraparound services at the school in a community that's really an underserved community? How do we provide that? And not only just serving the students, you're serving their families, you're serving the other community members that are around. It's really this just holistic, fantastic approach to kids. So how do you target those needs so they can be successful academically? Because our teachers want to teach. But these kids have so many other needs that the teachers just can't meet those needs. So if a kid can't see the board, how are they going to learn? But they may not verbalize that. Or if their shoes are too tight and they're in pain, or they've got a toothache. So really being able to partner has just been amazing. And we've seen such fantastic outcomes from kids in that wraparound model for the school. And really getting that message out there that we do that. I don't think a lot of people still know. While that is a visible program, we always invite volunteers to come. We always need more help into any interactions with these kids because they just need that love, that support.
And outside volunteers, not necessarily from that particular school zone, retired teachers, business people, others that are willing to give just an hour or 3, whether it's a week, a day, a month, because those are the folks that help provide that support for the things that community is missing. You mentioned shoes, okay? Yeah. The community members are struggling to pay their own bills, okay? And while they'd love to buy an extra pair of shoes aren't exactly cheap anymore, I found out. Like $80? Are you kidding me? That is it shoes or is it food? And so if small businesses or Rotary clubs, Kiwanis, others can help support that through their fundraising and their service projects, that's huge. And so it's my understanding that the support at each one of the CHS schools that you all provide does include a community liaison, someone who reaches out and explains what's going on and is there to receive the bundles of joy that might come in the door.
Yes. Yeah. If I could, I would tell you the number one thing that drew me to CHS was this concept. It's a concept now moving forward for CHS where we're talking about the cradle to career. And so as we build this out, we're looking at an infrastructure. It's going to start with neighborhood resource centers, early childhood Head Start programs, right into the community partnership schools. So it's cradle to career. And, in DCF, we had the sometime gut-wrenching responsibility to go into a home after the allegations had been received and have to decide whether or not we're going to remove a child from their parents because we need to, to make them safe. But what we're doing here with CHS with this concept is we're moving upstream. We're trying to reach the families and the children where they are before there's an issue, to keep them out of the child welfare system, and to these resource centers are in the neighborhoods, the zip codes where we know the issues are, and move them into early childhood Head Start programs, and then move them into a partnership school. How awesome is that? I was like that. I heard that, and I'm like, that's the answer. That's I said to Lauren earlier today, we were talking. I was like, why didn't someone think of this concept earlier? This is the answer. This is how you get to these children and families upstream, get them the preventive services and resources they need, and they'll never come into the child welfare system.
Well, we're going to take a short break, and then I've got something that is a corollary to that might give you some hope. So stay with us. We have a word from our sponsors for a couple of minutes, and we'll be back. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Right now at Sunshine Furniture, it's holiday sale time. You can save up to 50% on selected groups of indoor and outdoor furniture from Lloyd Flanders, Telescope, Windward, Capri, Seawinds, Universal, Lexington, and lots more. Sofas, love seats, dining sets, patio groups, occasional chairs, dining and bedroom sets, all on sale just in time to make Santa say ho, ho, ho. We have the largest selection of coastal furniture on the Treasure Coast, including a gallery of Berlin Garden, Pollywood, Hooker, Tommy Bahama, and Lexington. Also, all pictures, lamps, and accessories are half off. And don't forget to visit our outlet and sales store just across the street from our main location with lots of new closeout and markdown pieces. Sunshine Furniture, $12.95 US 1 in the Publix Plaza Vero Beach. Visit our website at sunshinefurniturecasual.com. Come in now for our holiday half-price sale.
Sunshine Furniture.
The holidays are sweeter with United Way and Hale Groves. Now through December 25th, shop fresh, delicious citrus at halegroves.com/UnitedWay and support essential community programs. Use promo code UnitedWay24 at checkout to get 5% off. And Hale Groves will donate 15% of your purchase to United Way of Indian River County. Your order helps fund health, education, and financial stability programs for hardworking families. Spread cheer and give back this holiday season. Visit halegroves.com/UnitedWay today. Offer ends Christmas Day. Don't miss this sweet chance to make a difference.
And welcome back to Community Conversations. If you're just joining, my name is Vicki Soule, CEO of Treasure Coast Community Health, and it's my honor and privilege to invite community members in each week to give some conversational thought to what they do, how they do it, how we might interplay more positively to continue with the strong community that we have. And today is no exception. We have Lauren and Dennis, both from CHS, Children's Home Society, which we associate most often with our Dodgertown Elementary. But these folks operate at the state level. And so during the break, I asked them, what would you like to talk about for our remaining 5 or 6 minutes? And Dennis, I'm going to turn it back over to you for an instant rerun.
Thank you. Well, as I stepped into this role and I looked at, all the opportunity there and where do I go next? What do I really focus on? 2 big priorities step up. And one is to really build the infrastructure of what we want to do. We need to have a very strong board of directors. And I really want to reach out to the community and find influential folks who are willing to step up and say, I want to be part of this. I want to help drive this organization forward. So whether you have a finance background, insurance background, medical background, education, child welfare, behavioral health, please reach out to us. We're in the very beginnings of really building a fantastic board, and that's what we need. We need over the top. We need some great folks to step up and help us guide this organization forward. And the second thing is all these things we're talking about, all these programs, everything is fantastic, but obviously it takes money to run them. And so whether you can volunteer your time or you can donate to the agency, our website is up. Give us a holler. We need all the help we can get, but we have a future in front of us that is. It's what brought me here. It's exciting, and there's so much that we can accomplish, but we need the leadership on board, and obviously we need the assistance.
So many of our affluent and really inspirational leaders are what we call our snowbirds. They have multiple residences, and they choose to spend the coldest months with us. But being a board member, would they be able to come in through a Zoom pathway? Do they have to be here 12 months a year?
No, I think many of our meetings are, in this day and age are Zoom. I'm sure, we're not going to turn away somebody who wants to help.
Just ask it.
One way or the other, if somebody wants to step up and raise their hand and say, I want to be part of this movement. And that's what this is. This is a cradle to career movement. And to me, it's revolutionary. And it's what brought me here, as I said before. So if we've got somebody who raises their hand and says, how can I help? We're going to find a way for them to help.
Well, I promised before the break that I would tell you a story of hope. About 12 years ago, our district superintendent drew an initiative with a couple of parents that we now call the Moonshot Community Action Network. At that time, we were looking for a way to urgently activate our community to help improve the reading skills of our children, because we've known for some time that children need to learn up to third grade, because after third grade, they're responsible for reading to learn themselves. And there's been all kinds of peer-reviewed articles relative to the number of prison cells that are needed based on that recommendation or that ratio, because only 1 in 4 really ever catches up. And so that affects the entire community in terms of its success going forward, its economics. I mean, there's just all kinds of things. So the long story made short is this Moonshot Community Action Network continues to meet monthly. It has fellows, of which I am one. I kind of got sucked into this naively, and I love it because we have learned so much, even on the medical side, about how children learn and how early they learn, and best ways of putting things together like vocabularies and composition and things that we would never have imagined 30 years ago as being relevant for young children. I can remember when I sent my first and then my third off to kindergarten, it was like night and day. They have to tie their shoes to go into kindergarten, and now they have to learn a whole lot more than that. But we have figured out, as you said, the novelness of this movement calls for us all to participate with children from the very earliest stages on to make them successful and keep their families successful. And so things like supporting the families, I could go on for hours, but I won't, because we're running out of time. And I want Lauren to be able to wrap up anything that she has to say relative to contacting you all at a local level or a state level, please.
Sure, and we can give our contact information. I know our website is on there, but Dennis had mentioned our needs around donations and volunteers. But volunteers, I believe, is the perfect way to really see what we do, see our programs in action. So I really invite everybody to reach out to Dennis or myself to come tour our shelter. We have a physical shelter in St. Lucie County that serves the entire Treasure Coast. Come to Dodgertown, see the work in action. We've got a lot of programs out there, and I think sometimes people don't know. And for me, some people are very visual. So come see what we do and how you can help and really know the services that our community provides, which is just amazing.
It certainly is. And I think that's key to everyone's giving philosophy is, you give to those things that you feel passionate about. How can you feel passionate about something, an organization that you don't know much about? So I encourage all of you at this giving season to think about doing that. It's never too late. It's never an imposition on the places that you want to visit. Just give a call ahead of time, because most of us have to follow certain security measures in today's day and age, particularly as it pertains to children. So I thank you both very much for being here.
Thank you.
Those 24 minutes passed really quickly.
Very quickly.
We're gonna put you back on the roster for maybe 6 months from now.
Sure.
When you get a little time under your belt, Dennis, you can come back and give us a progress report.
Thank you.
And Lauren, thank you so much for what you do in all the programs and operations. It's not an easy job, I know.
Thank you.
And thank you all for staying with us to the end. I hope that you pass this information on to the relevant people in your life that can use this information. And have a really great evening. Bye-bye now.